We have here a 40-year-old patient with different fibromas. We're going to remove them with cryosurgery using the liquid phase of nitrous oxide. For that purpose, we use the cryo equipped with a 2 mm tip. The treatment time is 4 to 5 seconds. The patient says that he feels almost no pain. This patient is 58 years old and has a small, light brown tumor. The examination with the dermatoscope clearly shows that it is a seborrheic wart. With a cryo equipped with a 4 mm tip, we're going to treat during 5 to 7 seconds. After approximately 10 to 14 days, the wart will fall off. The normal pigmentation will turn up again after a few weeks. On the same patient, we have another seborrheic wart. We are treating it the same way, also using a 4 mm tip. It is absolutely recommended to warm up the tissue around the treated area with the fingers. A scab will form and fall off within 10 to 14 days. Again, on the same patient, we have another seborrheic wart. This time, we will remove it with a cryo equipped with a contact applicator having a diameter of 5 mm. Opposite to the liquid phase shown before, we have to cool down the applicator for 10 seconds until the front of the tip gets visibly white. After this, we're putting the tip with a light pressure onto the skin. To perform the treatment, we keep the lever pressed for 5 to 7 seconds. The reaction on the skin can be well seen. After a few seconds, the skin is thawing and a light reddening will appear. Again, on the same patient, another seborrheic wart, rather flat. That can be detected with the dermatoscope. We work again with the contact applicator, which has to be cooled down first for 10 seconds. After this, we're going to treat for 6 to 7 seconds while pressing the lever. The tissue smoothly thaws, and once the scab is formed, it will fall off after 10 to 14 days. The patient felt twice a moderate pain, disappearing after a few seconds. This patient, 55 years old, has multiple small hemangiomas, often called blood sponges or pois rubis. We're going to treat them with a cryo for 4 seconds. The patient reacts to the cold, but does not feel any pain. The reaction is visible. A hyperemia is forming in the area of the hemangioma. After the thrombosis, they will fall off within 1 to 2 weeks. The same patient feels annoyed by several small seborrheic warts. We are removing them again with the cryo alpha perfect and are treating during 4 to 5 seconds. Once the crust is formed, they will also fall off within 10 to 14 days. This patient, 53 years old, has a flat wart on the left thumb. We are removing this wart with a 5 mm contact applicator, which is, as shown before, cooled down for 10 seconds, and then we are treating for 5 to 6 seconds. The reaction of the patient shows that he feels no pain at all. This 40-year-old patient has a 2-year-old plantar wart on the lateral part of the left foot. Looking at this kind of warts, it is recommendable to execute a curettage prior to any treatment. This time, the treatment is done without any curettage. These plantar warts are deeply penetrating, and a treatment time of 15 to 20 seconds is absolutely justified. Normally, one application is sufficient looking at this treatment duration. The patient felt almost no pain.